Medications given in preterm delivery. This presentation is aimed at expectant parents who have been told that their baby might be born prematurely. This presentation has been created by medical students at King's College London with the aim of improving patient-informed consent to the medications given in preterm labour. Any baby that is born before 37 weeks is considered preterm, meaning 3 or more weeks before their estimated date of delivery or due date. Prematurity is a spectrum. Babies can also be born very preterm, meaning between 28 weeks and 31 weeks and 6 days, and extremely preterm, at less than 28 weeks. The more preterm a baby is, the more support they will likely need after they've been born. Your doctors and midwives will talk to you about the risks of early birth, and they can help you make decisions about your baby's care. 4 important aspects they will discuss with you are the place of birth and the medications you might receive in the context of preterm labor, namely magnesium sulfate, steroids, and prophylactic antibiotics. As mentioned in the previous slide, some preterm babies need a lot of care after they've been born, so it's important to think about where you give birth if you go into preterm labor. If you were planning to give birth in a maternity unit, for example, it might be suggested that you transfer to a larger hospital that has a neonatal unit to best support your baby once it has been born. You may further require 1 or more of the aforementioned medications. This is what we will talk you through today. Let's start with magnesium sulfate. Given the positive effect magnesium sulfate can have on you and your baby, it has been advised that all women giving birth before 30 weeks of gestation should receive antenatal magnesium sulfate within the 24 hours prior to birth. How is magnesium sulfate given? The doctor or midwife will put an intravenous cannula in your hand or arm. The first dose will be given to you by the doctor, as a single intravenous injection over 10 minutes. Following this, a second dose is given to you more slowly, as an infusion pump over a 24-hour period. It is important that magnesium sulfate is given at least 4 hours before your baby is born for it to be effective. You and your baby will be monitored closely throughout. What are the risks of taking magnesium sulfate? Women who are given magnesium sulfate may experience some short-term effects. The most likely side effect is feeling nauseous and/or vomiting and headaches. Women also report feeling hot when having the initial single dose. You will, however, be monitored closely throughout the entire process. There are no increased risks to a premature baby when a mother is given magnesium sulfate.
The next drug on our list are steroids. The main reason steroids are given is to speed up the development of the baby's underdeveloped lungs. These will help the baby breathe and stop breathing problems at birth. Not only have steroids been shown to decrease the amount of serious breathing problems, they've also been shown to decrease the rate of death in the first few weeks of life, decrease the amount of brain bleeds, and also gut problems. Antenatal steroids are given via 2 injections into one of your muscles. These will be given 12 to 24 hours apart and ideally within the 7 days prior to giving birth. In terms of side effects, you as the mother may experience difficulty sleeping for a short period of time. The baby may initially be slightly smaller at birth. However, catch-up growth will occur over the following year and they will catch up to where we expect them to be. Overdose or repeated doses of steroids may alter and affect the brain development of the baby. However, precautions will be taken place to ensure that this does not occur. Overall, there is no evidence of long-term side effects to you or your baby.
And finally, antibiotics. Antibiotics may be offered to women in preterm labour to help to prevent serious infections caused by harmful bacteria called Group B streptococcal bacteria. The antibiotics reduce the risk of these bacteria affecting your baby during delivery. GBS stands for Group B Streptococcus, which are a type of bacteria that can be found in the bowel, vagina, and urethra of about 20 to 40% of women. Most of the time, these colonies of bacteria do not cause any harm or produce any symptoms. However, there is a small chance that when you give birth, your baby might become infected. GBS bacteria are the leading cause of sepsis, pneumonia, and meningitis in newborns. Because premature babies are often more vulnerable to severe infection, antibiotics are recommended to all women giving birth before 37 weeks. Although there is only a small chance of your baby becoming infected with GBS, in preterm babies, around 23%, so that's 1 in 4, of those who become infected with GBS will unfortunately die. Giving antibiotics to the mother during labour has been shown to significantly reduce the risk of death. They'll be given through a drip into one of your veins while you're in labour and should be given at least 4 hours before your baby is born. What's the risk of harm from antibiotics? You may experience some short-term side effects such as feeling sick and diarrhea, and there is a rare chance of you having a severe allergic reaction such as anaphylaxis. However, you will be monitored throughout. There is no evidence of long-term side effects to you or your baby.
So in summary, magnesium sulfate, steroids, antibiotics are 3 drugs which you may be given in preterm labour to help prevent serious harm to your baby. If you have any questions about these 3 drugs or any of the information in this video, please do ask your doctor.